Nova Scotia announced a new plan to improve its emergency rooms after the deaths of two women who waited hours for care. But in a letter to the Premier, some doctors argued the provisions don't address the root of the problem, which they say is a bed shortage. Here is Premier Tim Houston's response.
There is no one single fix, and of course, as we make some change, then somebody will say, "What about this?" And that'll probably happen until the end of time, and that's okay because we'll keep addressing the what about this.
Dr. Lorri Beatty is part of a group of emergency room doctors who raised concerns with the Premier. She is the program director at Dalhousie University's Department of Emergency Medicine. Dr. Beatty, thank you for speaking with us. Much of this letter is about the lack of hospital beds. Can you describe what it is like to be an doctor without adequate bed space?
Sure, I can certainly speak to the experience here at the Halifax Infirmary, where on a daily basis, anywhere from 50 to 70% of our emergency department beds, those intended to care for patients with acute emergencies, are filled with admitted patients. And on bad days, that number can reach closer to 95%. And so we're constantly faced with a challenge of trying to find space to care for those coming to us who are acutely ill or injured and need emergency care.
Why did you decide to be a part of this letter?
When the news came out 2 days ago with the proposed changes, I think myself and many of my colleagues had two reactions. First is that we're really happy to see that the government is keen to engage on this and that they're motivated to make change, because that's going to help Nova Scotians. But secondly, the announcements that we heard, for our side at least, we were concerned that they're not going to actually speed patient access to emergency care, because our issue is that of patient boarding or access block, where all of our beds and resources are going into caring for admitted patients, and there's just no space or personnel to care for those emergencies. And so if the province is going to put a lot of money and resources into fixing this problem, we wanted to make sure that they institute changes that actually address the underlying root cause.
What do you make of the Premier's response so far?
I'm happy to hear it. I think what we all want as emergency care providers at the end of the day is the best possible emergency care and access to quick emergency care for our patients. And so hearing that the government is keen and engaged to make real changes that will bring that about makes us feel great.
I know that Nova Scotia has received a lot of scrutiny after the deaths of two women who waited hours and hours for care. It's part of a larger problem. It's not just Nova Scotia that is experiencing challenges in emergency medicine, but healthcare across the board. I'm curious, in Nova Scotia, how would you rate the way that the Premier and his team are handling the issue of healthcare right now?
That's a challenging question for me, because I can't speak, knowledgeably about how it's being handled in comparison to other provinces.
Yeah.
I can say that right now, as an emergency physician, I'm happy to see that this issue is being addressed and that the government appears ready to listen to suggestions that will get to the root of the problem instead of putting Band-Aids on things.
The Premier of Ontario announced that his government is going to be expanding for different kinds of procedures at for-profit clinics. He says patients aren't going to care, but patients are going to pay, not care, that patients won't be paying for care. But at the same time, there is concern that it could actually end up taking resources away from provincial, from public hospitals and healthcare. When we spoke with Tim Houston earlier this week, he said those programs already exist in Nova Scotia and that they're looking at expanding them as well. Do you have concerns if care through private facilities is expanded? Is that going to hurt the ERs?
I don't know if I can answer that question well. I can say that the ERs, or the emergency departments, are going to keep doing our best to provide emergency care for patients. The best way to do that is to move admitted patients out of the emergency department into inpatient hospital beds where they're going to get the best care. They're going to have access to inpatient services that we can't provide in the emergency department. And it's going to allow our ambulances to offload more quickly, and it's going to get the line moving through the waiting room to get those patients in to see us sooner.
Can you describe the morale among frontline healthcare workers right now in your province? What's it like?
I hate to speak for a huge group of people, but I can certainly say for myself, and I assume for many of my colleagues, that it's really challenging to see patients waiting for a long, long time trying to get care, patients trying to access care elsewhere and being unable to, patients waiting in the community for ambulances that are delayed in coming because those ambulances are stuck in our hospital. And I see colleagues, nurses in particular, in our emergency department leaving emergency medicine, although it's something that they've done specialty training to do and that they love doing, because it's such a challenging environment in which to work right now.
So if you had one specific thing, one specific fix that you need right now, what would you say it is to make your ability to provide care in your ER better?
Right. The first thing that we're hoping for is accountability and responsibility within the system. And so that's something that can happen quickly. It's not going to take 3 to 5 years like long-term care beds, which are a great solution. And it's something that doesn't cost a lot of money. There are a number of policies that exist already to help move admitted patients into inpatient beds and help patients flow through the system to discharge. But those policies aren't enforced and no one is held accountable for them. If we saw accountability applied throughout the healthcare system and within the hospitals, I think that that would make a difference. And along with that, we need bed management that's present 24/7 every day of the year, because that's when our emergency department is trying to care for emergency patients. The bed manager needs to have authority and decision-making power to make difficult decisions and move patients through the system.
Tell me a little bit about accountability. Describe for me how you think that that would work.
Sure. Can I give an example?
Absolutely. Yes. Tell us.
So let's say on any given day, we have ambulances lined up with patients waiting to get into emergency department beds. And we have patients in emergency department beds waiting to go upstairs. There may be empty beds on the floors, or there may be patients ready to be discharged home, but paperwork might not be ready for whatever reason. The discharge planning hasn't come to fruition. And so if we were enforcing rules around having patients ready for discharge the day before, if we were enforcing policies around having patients out of their bed by 11 o'clock that morning so the bed can be cleaned and turned over, if we were enforcing policies around getting consulted patients, which are those that require specialists to see them, seen quickly in the emergency department, and policies like the rule that pushes patients in the ED up to the floor when there are ambulance waiting for beds, enforcing policies that already exist would make a big difference. But there's not the accountability on individuals and groups within the system to have those policies enforced and to have those things happen right now.
All right, Dr. Lorri Beatty, thank you very much for your time.
Thank you for having me.